In this morning's Health Watch, dollars for docs. According to the nonprofit journalism organization ProPublica, over the past 2 years, 12 drug companies have given doctors and other healthcare providers more than $760 million. Now that begs the question, is your healthcare being compromised? Joining us now for more on that is Dr. John Santa. He's the director of the Consumer Reports Health Ratings Center. Dr. Santa, good morning to you.
Good morning.
Overall, do you think these potential financial ties between drug companies and doctors impacts in a negative way the kind of medical care we receive?
Absolutely. Money works. Doctors are human. Doctors who take money from drug companies are more likely to give you an expensive drug or more likely to give you a drug you may not need.
I'm guessing that you would be reluctant to advise someone to go to a doctor who has this type of relationship.
I would. The issue is who are you working for? Me as the patient or the drug company you're taking money from?
Let's talk about a poll by Consumer Reports. Nearly 72% of those that you talk to believe that pharmaceutical companies have too much influence on the drugs that doctors prescribe. So given this statistic and given what you know, in some cases are doctors not giving patients alternatives, cheaper alternatives in some cases?
Absolutely. We know from our studies and others that there are still many opportunities for doctors to prescribe generic drugs, and they're not doing it, and one of the reasons is these financial relationships.
The ProPublica database is an easy way to search through some of these records, but it's important for patients, as you say, to keep an eye on what their doctor's doing. You say when people go to the doctor, they should look for 3 things and then be kind of alerted if they see these things. First of all, if they see drug reps in the office.
That's right. The last time I was in a medical office, there were 3 drug representatives in the waiting room. I haven't been back.
Free samples as well. You say watch out for being a lot of those thrown on you.
That's right. People think, well, a free sample is a good thing. Well, the expensive prescription that follows it, if it works, is not a good thing. It can be, again, much more expensive drug than you may need.
You also say look for marketing materials.
That's right. Doctors who have relationships with drug companies will often have promotional materials, will have information that they give patients that come from the drug company. You should be wary of that.
Let's say this is a doctor you've been going to for a long time and you're just noticing these things right now. What question should you then ask?
Well, first of all, you shouldn't hesitate to ask, do you have a relationship with a drug company? Is it your policy in your practice to take money from drug companies? More and more, I think it's good for consumers to ask those kinds of questions. And what you should especially ask, though, is what are my other options?
Gotcha.
What are my other options?
A lot of people are going to see this and start asking those questions, I'm sure. Dr. John Santa, thank you very much.
Thank you.
We appreciate it.